शोल्डर ज्वाइंट. एक कोई एक इधर आ जाए. अब जैसे जैसे आप करते हैं ना वैसे वैसे करना. उधर मुड़ जाओ. This is flexion. Anterior movement of the humerus is the flexion. Posterior is extension. Posterior is the extension. This is flexion and this is extension. It occurs in sagittal plane. Sagittal suture होता है ना यहाँ पे, उसके along जो plane होता है that is sagittal plane. तो ये ऐसे इस तरह से हो रहा है तो sagittal plane है. Flexion, anterior movement of the humerus is the flexion and posteriorly this is extension. Now adduction towards the median plane. Humerus towards the median plane. जो बीच से जो लाइन जा रहा है शरीर के बीचों बीच is the median plane. ऐसे ले जाओ, एकदम सीधा रखो और ऐसे ले जाओ. This is adduction. Adduction towards the median plane. And away from the median plane is the abduction. This is abduction. You okay? Now, first flex the elbow joint and then rotate forearm medially. This is medial rotation. Medial rotation of humerus is happening here. First we have to flex. Flex the elbow joint and then if we take the forearm medially, the movement occur in the shoulder joint is known as medial rotation and this is lateral rotation. First we have to flex the elbow joint and then if we move away from the median plane, the forearm, then the movement occurring in the shoulder joint is the lateral rotation or external rotation. And if towards the median plane, it is medial rotation or internal rotation. कुछ भी कर सकते हैं. And combination of all these is the circumduction. There are 7 days in a week and there are 7 movements. Flexion, extension, adduction, abduction, medial rotation, lateral rotation, circumduction. These are the movements. Now about the range of motion. Range of motion. This is flexion. It is up to the 90 degree. Flexion 90 degree. Extension 45. 45. This is adduction again 45. Abduction 180. 180 abduction. Medial rotation 55. Lateral rotation 45. We can move medially more and laterally restricted. Only here. So medial rotation 55. Lateral rotation 45. Flexion 90. Extension 45. Adduction 45. Abduction 180. Medial rotation 55. Lateral rotation 45. ठीक है, ये हो गया. A muscle responsible for that. Flexion. Clavicular head of pectoralis major muscle. Only this much is the movement is occurring. So pectoralis major is lying here and it is attached over the clavicle as well as the sternum and the costal cartilage. So that is sternocostal head and this is clavicular head. So the clavicular head only, clavicular head of pectoralis major, flexion. Okay, only one muscle you have to write. Okay, so flexion, clavicular head of pectoralis major. Extension, latissimus dorsi. Posteriorly there is latissimus dorsi, a big muscle. Okay. Now adduction, this is sternocostal. Now it is going towards sternocostal head of pectoralis pectoralis major. So sternocostal head of pectoralis major and the anterior fiber and deltoid. Deltoid के 3 फाइबर होते हैं ना, anterior, superior, middle and the posterior. So anterior fiber also. ठीक हो गई? Sorry, this is adduction. And now about the abduction. 0 to 15 supraspinatus. 0 to 15 15 degree supraspinatus. 15 to 90 and 90 to 120 both deltoid. Above 120 serratus anterior and trapezius. 0 to 15 supraspinatus muscle. 15 to 90, 90 to 120 deltoid. Above 120, that is 120 to 180, is the serratus anterior plus trapezius. Okay? We will discuss it also there, the abduction in full detail. Okay? Now, after abduction, the medial rotation, the muscle responsible for the medial rotation is again the anterior fiber of deltoid and the coracobrachialis. Okay, here is also coracobrachialis. So coracobrachialis anterior fiber of deltoid and lateral rotation, there is posterior fiber of deltoid and the latissimus dorsi. ठीक है, पीछे है latissimus dorsi, ये posterior fiber भी पीछे है, तो उस तरफ जा रहा है ना, तो उधर का कॉन्ट्रैक्ट हो रहा है तो वो खींच रहा है उधर. ठीक है, तो ये सारे मसल्स हो गए.